Public health is always a question of politics, especially when you have a disease for which you don't have any medical solution, like a vaccine or a cure, in the way that, of course, is the case even largely today with COVID-19. So when you don't have a medical way of escaping it, there's no way of getting around the fundamental dilemma that some people have to be sacrificed in order to spare others, and that's fundamentally a political decision: who is to be sacrificed and how much is to be asked of them. So some, of course, are infected. Some people are in contact with the sick. These sorts of people have to be isolated. Some people are asymptomatic, do not have any symptoms, don't show any symptoms. In the way that's quite common with COVID, they remain dangerous. They have to be isolated even though they may be feeling fine. Of course, seen in the broadest perspective, only a small minority of citizens at any given moment are infected or dangerous, but they have to suffer if the rest is going to be spared, and the rest therefore not have to suffer. And so the question is, how much can politicians ask of those who are infected or contacts of the infected or potentially infected? How much can one ask of them to sacrifice for the general good? As we've seen in Asia, a great deal was asked of citizens. There were long quarantine times, there was drastic isolation, but the result was that the vast majority of citizens didn't end up suffering all that much. In the West, in contrast, our leaders didn't think that they could make these sorts of demands of us. So instead, they imposed much milder restrictions on Western citizens. This ended up culminating in the broad lockdowns that were imposed. But these lockdowns, as we all know, weren't nearly as drastic as what was imposed in Asia. And then, of course, during lockdown, some people had to work so that the rest of us could be spared and stay at home, all the frontline workers, whether in retail or in medicine and so forth. So all these sorts of decisions are fundamentally political decisions that are needed to solve what is ultimately a public health problem, because the fundamental decision that politicians had to take was, what were the necessary sacrifices? How were they to be distributed? And who was to suffer under them so that the majority could be spared?